So the Institute of Cancer Research joined Imperial College AHSC in the middle of this year, 2019. So now all of the major undergraduate and postgraduate hospitals in West London and the key institute have joined with Imperial College to sit round a table via the AHSC to be able to produce a single strategy for research, education and clinical service. The Institute of Cancer Research has a superb international reputation, particularly in the area of drug discovery for cancer, and I think we can align this terribly well with the Marsden and ICHT and the college around the CRUK Major Centre for Cancer. Very exciting time. Firstly, it's around convergent science. So Imperial College's sort of traditional core strengths in engineering, physical sciences, mathematics, computing, we want to make sure that we can get interdisciplinary working between the clinical areas and the strengths at Imperial around convergent science. And I think this will be the dominant feature going forward for all of our research plans. Nowhere is this better exemplified than at White City, where we've moved chemistry and now bioengineering adjacent to medicine and the School of Public Health and next to Hammersmith Hospital. That's the sort of the concept co-localization to fertilize interdisciplinary work. Second area is around data. So the ability to be able to store, analyze and use health data for research is the critical underpinning that will bring us together and lead to new discovery and new approaches to healthcare. So that we need to bring in the abilities that we have across the college in AI, artificial intelligence and machine learning, and really, I think, harness the new cadre of PhD students we're developing in this space through the Centre for AI in Healthcare. The third area is to really use the opportunities opened up to us through the School of Public Health. So here we have opportunities to move into the areas of early diagnosis and prevention, for which we need access to populations, not just to patients attending the hospital. And welding the prevention and early diagnosis theme into all of the areas of research that we undertake across the AHSC will be the third main plank going forward. So one of the most exciting developments over the past 12 months has been a coming together between Chelsea and Westminster Hospital and Imperial College Healthcare Trust with the college, with Imperial College London, to formulate West London Children's Healthcare Initiative. And this is to bring all paediatrics and child health under a single governance structure. So not different hospitals, but a single structure. And together with the college, I think we'll be investing heavily in new academic posts around child health and paediatrics. So I see this as extending all the way from tertiary paediatrics and critical care, all the way into population child health and adolescent mental health and everything in between. So extraordinary opportunities to bring research strengths into an area really which is poorly served. So if we're going to produce an academic health science centre which is genuinely delivering its tripartite mission, research, education and service, that has to be a whole workforce which is committed to that. And that means the ability to train up the whole workforce in understanding research and research mission of the organisation. So that's not just training the doctors, but it's training the nurses, the allied health professionals, the therapists, the pharmacists, and so on. And working with the National Institute for Health Research and with our local charities, we've developed an ambitious programme for accelerating PhD level research training across all disciplines, including medicine. We coordinate it through our Clinical Academic Training Office, CATO. I think our Imperial College Academic Health Science Centre is unique in terms of being a tight relationship between these world-renowned hospitals, the Marsden, the Brompton, Mary's, Hammersmith, Charing Cross, together with the Institute of Cancer Research and the college, all of which have very high international reputations in their field. And being able to align across those in a way which is mutually beneficial to all members of the organisation but collectively greater than the sum of the parts. I think we're adept enough now and confident enough as a partnership to really see substantial benefit and change to patient health. An early priority is to bring one more partner into the fold, and that's Chelsea and Westminster. There are so many interactions now between Chel West, ICHT and the college that I think full partnership with the AHSC would be the easiest way to manage this. I'd like to see over the next 5 years a flowering of our major centre, our CRUK Major Cancer Centre, which brings the Marsden Institute of Cancer Research and the college together, moving that into convergent science, and the opportunities at the School of Public Health are immense, particularly in early diagnosis of cancer. I'd like to feel that we had made real inroads into aspects of child health research and delivery at a population level. Again, thinking of the White City spacing and the opportunity there to work with White City community and with local government, entirely new areas for us to work in, and where we've had very substantial philanthropic support to build new capacity. So, and then finally, of course, the area of data. I think the college will be creating the infrastructure to be able to handle health data at scale, and most importantly, to be able to analyse it at scale. And for that we need all of the skills really across the university in mathematics, in computing and data science. And I see the college bringing immense benefit to the NHS in that space.